welcome. I'm Preeti Prakash. In this series of health, we've tried to get to our viewers some insights into the mind of people suffering from chronic problems and how they have bounced back. We also have got for our viewers specialists' take on these various diseases. Our purpose behind these stories is to bring to you battles fought by victors. I will not say survivors. I'll particularly use the word victors with their sheer courage, hope, and positivity. Also, the message that awareness about one's body and self is very important. So it's important to go and get yourself regularly checked so that you know what your body is developing or undergoing. So to talk about this, I have with me today Akshit Singhal, who's into digital marketing with Wipro. He's all just about 22 and was diagnosed with low grade glioma, which in generally in layman terms we would call brain tumor. And he's now perfectly well and he's around his job. Naresh Kumar Jain, who's into business, was diagnosed with the non-Hodgkin's lymphoma, which we call as blood cancer. He was also treated by chemo and radiation, and he's doing perfectly fine now. I have with me Dr. Aditi Agarwal. She's a senior consultant radiation oncologist at Paras Hospital, Gurgaon, and with a 15-year of experience under her belt. Welcome to all my guests.
Hi guys.
Let me start with you, Akshit, by asking you. You're so young, just about 22. You have your entire life in front of you. What was, what were the first signals that prompted you to, go for a checkup, for a diagnosis, which brought that worry into your mind that something is wrong with my self, and later on, leading to the experience of your treatment?
Actually, I was not aware that I have something or anything like that. It's just that I got a seizure on the road. Then I got diagnosed with the glioma, and I went to multiple hospitals. Then I found Dr. Mehta over there, through which I got my carotenotomy. The surgery, brain surgery, happened in the month of July of 2021. I was 21 at that time. So, in the month of April, I got this diagnosis, and uh, then I got my surgery in the month of July. After the surgery, it was been found out that some part was still remaining in the brain of the tumor that cannot be removed. It was very deep down there. So he advised that I should go to like an oncologist. He recommended Dr. Aditi, who's there with us on the panel. He mentioned that I should go there. She mentioned I require some radiation therapy at that time to just stop the growth of that particular part that is there, because it's second grade, so it's cancerous, called cancerous. It could be cancer that might grow again. So uh, I went through a radiation therapy and then a chemotherapy of 12 months. So it was all that I has been going through, and some anti-epileptic medicines that are there after all. I have to keep on.
Okay, how was it at all affecting your daily life, when you were still in the diagnosis process, or you came to know that such a thing exists on top of your head? Did it disturb you anyways? Did it affect you emotionally, psychologically, um, or maybe memory loss or something like this?
Yeah, actually, at the starting, the day that I got the first seizure on the road, that day I like lost my memory for past 2 3 days for 30 approx 30 minutes, and after that it was quite normal. It was just I was going under some MRIs and all to get the proper location of what it is, why I got the seizure. So I got multiple MRIs being done. Like there are MRIs that are with some they call it colored MRIs, you can say, or with contrast and without contrast MRIs. I got checked with multiple doctors in multiple hospitals, and hearing a word like a cancerous tumor in your brain, it's a very big thing for a normal Indian middle class family. So it was a big thing at the starting, but yeah, eventually, slowly and eventually, doctors start calming me down that it's not that big. You are young, you will be able to cope up with it. So yeah, starting it was bit traumatic, but eventually it goes like a slow down lane. It goes well.
If you could share with us some about regarding financials, what was the cost that, generally, this is for our audience information also, that what I've generally heard, cancer treatment is pretty expensive. If only if you're going to a government hospital, maybe you get some free treatments and all, but otherwise it's a pretty expensive treatment. So what were your financials, and how did it affect you and your family at all?
Yeah, actually, I was not working at that time, so I do not had any particular this medical insurance done. So I had to pay in cash, and also I checked for multiple hospitals. There were 7 lakhs, 8 lakhs, like as per your the type of hospital you go in. So the one that I went into Paris, it costed me approximately 5 lakhs for the surgery, then another 2-3 lakhs for the radiation therapy, and after that it was my chemotherapy and all, which were like just doctor fees and medicine costs. So
So,
approximately it will cost around 11 to 12 lakhs for the whole treatment.
and plus the treatment that is now also going in
Going
future.
on. Yeah.
That is separate. Okay. Now coming to Naresh Jain ji. नरेश जी, आपको क्या सिम्टम्स लगे, या फिर आपको कब पता चला कि आपको ये प्रॉब्लम है इसका, ब्लड कैंसर का, और आपने भी कोई डिफिकल्टीज और चैलेंजेस फेस किए इसके ट्रीटमेंट के दौरान?
नहीं, जो सबसे स्टार्ट किया वो मेरा पैर में दर्द हो गया था, लेफ्ट पैर में, तो चलने में दिक्कत हो गई थी मुझे। मैं चल नहीं पाता था लेफ्ट पैर से, तो बिल्कुल ही नहीं। तो फिर वो डायग्नोज हुआ पारस में ही, तो वो उन्होंने फिर लास्ट में यही बताया कि आपको करीब 1 हफ्ते में एडमिट रहा हुआ। तो उन्होंने अलग 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 चीजें की, किसी ने कोई ये कहा कि इन्फेक्शन है बोन में, इस तरीके से। फिर लास्ट में ये बिल्कुल ही ऐसा हुआ कि भी ये लिम्फोमा, ये बताया गया मुझे। डॉक्टर रंगाराव ने ट्रीटमेंट दिया, बहुत अच्छा लगा मुझे।
अच्छा, कोई चैलेंजेस जैसे?
नहीं, कोई चैलेंज नहीं हुआ, और आराम से मैं करता रह गया। वो 21 दिन में मुझे बुलाते थे कीमो के लिए, तो मैं चला जाता था।
अच्छा, सो एंटायरली आप कीमो और रेडिएशन से आपका ब्लड का ठीक हो गया। और ऑल्सो एज एक फैक्टर, आपको लगा कि एज एक फैक्टर हो सकता है ये ब्लड?
मुझे कुछ भी नहीं लगा वो। एक ऐसा लगा कि नॉर्मल है कोई ये चीज।
ओके।
जैसे
तो जब आपको पता चला कि आपको बताया कि भाई आपको ब्लड कैंसर है, तो आपकी मनस्थिति, मानसिक स्थिति में कुछ आपको ऐसा लगा कि अब मैं, जो एक नेचुरल क्वेश्चन होता है सुनते ही कि भाई आपको कैंसर है, तो लोग अब पहला यही सोचते हैं कि अब मैं अब कितने दिन जीऊंगा, और तो ऐसा कुछ फेयर या कुछ ऐसा?
ऐसा कुछ भी नहीं हुआ। डॉक्टर अदिति ने बहुत अच्छे तरीके से हैंडल किया। उन्होंने सारी बात लिख करके बताई, एक एक चीज के ऐसे होगा, ये होगा, वो होगा, और आप करीब 3 या 4 महीने में अब तो दौड़ने लगोगे, भागने लगोगे, कोई दिक्कत नहीं, सब कुछ नॉर्मल हो जाएगा पहले की तरह।
आपका सपोर्ट सिस्टम, आपकी फैमिली होगी, फैमिली
सबसे ज्यादा फैमिली ने सपोर्ट किया, प्लस पॉजिटिविटी ने, जो मेरे साथ थे लोग, मेरे फ्रेंड सर्कल, उन्होंने भी सारा पॉजिटिव ही सोच बनाए रखी। उन्होंने अपने अपने कुछ चीजें बताई कि भी उसका ये हो गया था, इसका ये ठीक हो गए, सारे रिकवर हो गए बिल्कुल ही।
वेरी नाइस। आपके एक्सपेंसेस का, आपके फाइनेंशियल्स का क्या रहा? कितना आपको इसमें खर्चा हुआ, और कितना लंबा चला?
ये तो करीब 6-7 महीने चला होगा। लेकिन मैं अगर बात करूं तो मैं बहुत ही मिडिल फैमिली से हूं, एक तो, और दूसरी बात ये है कि एक मेडिकल इंश्योरेंस है, उसने बचा लिया पैसों का। तो 8-10 लाख रुपए मेरे भी लग गए हैं, लेकिन वो सब उसमें ही एडजस्ट हो गए। बजाज एयरलाइंस वगैरह 2-3 ले रखी है मैंने इंश्योरेंस कंपनियां, तो एडजस्टमेंट होगी, अदरवाइज बिल्कुल नहीं होता, बहुत मुश्किल हो जाता है क्योंकि बहुत एक्सपेंसिव है हर चीज। शायद डॉक्टरों की भी कोई गलती नहीं है, हो सकता है वहाँ ऐसे ही सिस्टम बन रहा हो, कोई वो तो करेंगे नहीं, जो भी इनका हिसाब किताब है फ्री में, तो ऐसा है ही नहीं ना, ये तो पैसे तो देने ही पड़ेंगे। तो मेरे लग गए होंगे लगभग 10 लाख।
अच्छा, तो इसका मतलब ये है कि इंश्योरेंस आप जो बोल रहे हैं उसका एक मतलब ये निकलता है कि इंश्योरेंस करा लेना एक अच्छी बात है।
जी हाँ जी, बिल्कुल।
मेडिकल इंश्योरेंस जरूर, और अब आई थिंक सरकार भी काफी कई राज्यों में तो सरकार फ्री मेडिकल इंश्योरेंस भी देती है। सो इंश्योरेंस इज वन बिग हेल्प आई गेस, है ना?
सबसे ज्यादा उसने हेल्प की मुझे, तो मेडिकल इंश्योरेंस था।
Okay, coming to Dr. Aditi Agarwal. Dr. Aditi, what are the symptoms that that can show in the presence of cancer in someone's blood, that that can help diagnose at what stage the cancer is? And I'll also like to ask, then what is the process of this entire treatment? You particularly being from radiology and so do tell our viewers about that.
So, if we talk about blood cancers, there are broadly two kinds of blood cancers. एक को leukemia कहते हैं, दूसरे को हम lymphoma कहते हैं. Then we have further subtypes of leukemia. For example, there can be AML, there can be CML, acute and chronic. Then there can be lymphomas, which can be broadly classified into Hodgkin's lymphoma and non-Hodgkin's lymphoma. Then there are further subtypings of these leukemias and lymphomas as well. So अगर मैं डायग्नोसिस की बात करूं तो ल्यूकीमियाज और लिम्फोमास की प्रेजेंटेशन यूजुअली अलग होती है. ल्यूकीमियाज में ब्लड काउंट्स पे फर्क पड़ता है, तो नॉन स्पेसिफिक से सिम्टम्स होते हैं. जैसे ल्यूकीमियाज बच्चों में ज्यादा कॉमन होते हैं, तो उनमें फीवर रह सकता है जो कि बार बार हो रहा है, बार बार थकान हो रही है उनको. देन देयर मे बी सम लिम्फ नोड्स, कोई गांठें जो पैल्पेबल हो सकती हैं, जो दिख रही हो, भूख कम लगना, चिड़चिड़ापन. सो ये बहुत ही नॉन स्पेसिफिक से सिम्टम्स होते हैं. यूजुअली पेरेंट्स तब प्रेजेंट करते हैं हमारे पास जब ये सेटल नहीं हो रहे होते हैं. फॉर एग्जाम्पल, कोई बच्चा जो बार बार बीमार पड़ रहा है, उसको नॉर्मली ट्रीट किया, द ट्रीटमेंट इज नॉट, ही इज नॉट रिस्पॉन्डिंग, देन सम ब्लड टेस्ट इज डन, that blood test shows some abnormality, then they think, okay, why is this blood test abnormal? Then they go for further testing, which may include bone marrow aspiration and biopsy. Likewise, in adults also, if leukemia occurs, then it may present with infections. Sometimes it may present with vague symptoms like chest pain हो सकता है, arm में pain हो सकता है, leg में cramps हो सकते हैं. So as I'm saying, these are very normal and very non-specific symptoms. So somebody having leg cramps does not mean उसको leukemia हो गया. Somebody having chest pain does not mean उसको leukemia हो गया. But then when something is not settling and there are other things along with it, for example, there may be loss of appetite, the patient may be losing weight, the patient may be having some blood parameters which are disturbed, then we start thinking on those lines. So agar patient ko kya karna chahiye jaldi diagnosis ke liye, if something is not responding to the classical way that it should, if your doctor says that this is the usual way and you're not responding, then definitely don't ignore it. Most of the times people have a misconception that फीवर है ठीक हो जाएगा, वेट लॉस है ठीक हो जाएगा, मैं एक्सरसाइज कर रहा हूँ इसलिए वेट लॉस हो रहा है. वी ट्राई टू फाइंड एन एक्सक्यूज ऑन आवर ओन इन आवर माइंड कि ये इसलिए हो रहा है. बट इफ समथिंग इज नॉट सेटलिंग, देन यू शुड get yourself tested thoroughly. What those tests will be decided by your doctor only. Many a times we get very vague kind of requests saying कि हमारी ये प्रॉब्लम है, आप ना पेट सीटी कर दो. Yeah, patients sometimes come to us with a PET CT directly. So that should not be done, because PET CT, though it is a very useful investigation, but when it is done with no reason, there is a risk of radiation, there is a risk of dye going in. Then there is a CT scan which is being done, and it may give us some information which will not lead us to anywhere. Okay, now when I talk of lymphomas again, they usually present with some lymph nodes. जैसे कि नरेश जी ने बताया कि इनको पैर में दर्द था, this is not a very usual form of presentation of lymphomas. The lymphoma that he had was involving the bone. So bone lymphoma, extranodal lymphoma, lymph node के अलावा वाला lymphoma is not very common. I wouldn't say that it does not occur, but it is not as common as lymph nodes में जो occur करता है. So his leg pain was not settling. he got investigated. ऐसे ही अगर कोई चीज settle नहीं हो रही है, then definitely we should get investigated and we should consult and follow our doctor. That is the only thing that can be done for early diagnosis. हर disease के symptoms अलग होंगे. यहाँ मैंने blood का बताया, अगर मैं brain की बात करूंगी तो अलग होंगे, अगर मैं head neck की बात करूंगी तो वो अलग होंगे. So if something is not responding, something is wrong in your body, then please thoroughly get yourself tested.
And there is, there's always a theory that you keep getting yourself at least your body examined once a year or maybe 6 months. Does that help?
So after a certain age, yes. But if I tell a 20-year-old or a 25-year-old that get yourself tested regularly once a year, I don't think that makes sense, because the incidence of cancer or any kind of cancer increases with age. And usually that becomes higher after the age of 40. Before the age of 40, there are few specific types of cancers or tumors that would occur. तो उनके लिए हम रेगुलरली स्क्रीन नहीं करते अनलेस कोई फैमिली हिस्ट्री होती है. सो इट इज सेड कि अगर फैमिली में किसी को कोई कैंसर हुआ है एट अ पर्टिकुलर एज, द नेक्स्ट जनरेशन शुड स्टार्ट गेटिंग देमसेल्व्स टेस्टेड 10 years अर्लियर. तो अगर किसी को ब्रेस्ट कैंसर 45 पर हुआ है किसी की फैमिली में, सो नेक्स्ट जनरेशन शुड स्टार्ट गेटिंग टेस्टेड एट द एज ऑफ 35. which is not the usual age of getting tested. Breast specifically ऐसा disease है जहाँ पे हम बोलते हैं कि 20-25 से females should start getting self examination done breast का. Doctor से particular examination 40-45 के बाद, yes, definitely once a year you should get yourself tested.
Okay, but since there may be some random cases, where somebody in the family has, say, mother, father, sister, somebody had it. So does that signal that everyone should, look out for their symptoms, even
No.
if there is no history as for that matter?
So there are some cancers that would run in the family and some that would not. For example, lymphomas हैं वो families में run नहीं करते हैं. It occurs as a random event. Brain tumors, some of them may run in families, और for that matter brain tumor के साथ उसी family में अलग अलग तरह के cancers भी मिल सकते हैं. Different relatives having different kinds of cancers, which are all linked to a faulty gene. So एक किसी को अगर कैंसर हुआ है इसका मतलब ये नहीं है कि that family history is positive and that family is at risk of developing cancer. So what cancer, what type of cancer, whether other members had that cancer or not, or some other cancer, that history is important, and based on that only we get genetic testing done. So we don't get all patients tested for these genetic mutations. Only when we think it is significant enough and it could be genetic, we get them tested.
Okay. Now, for the, for a layman's information, if you could just in short tell us the process of radiation and chemo.
Okay, so they work on two very different principles. Chemotherapy is in the form of injections or tablets. So it is a therapy which has an effect over disease over the entire body. Body में कहीं पे भी disease है, chemotherapy is going to act on it क्योंकि वो blood से जा रही है या orally tablets के through जा रही है. So eventually the chemotherapy is going into the blood. Radiation whereas is a local therapy. जैसे surgery भी एक local therapy होती है, तो वो उसी जगह की होती है जहां हम टारगेट कर रहे हैं. जिस जगह का सर्जरी कर रहे हैं उसका इफेक्ट भी वहीं पर आएगा. इसी तरह से रेडिएशन इज अ लोकल थेरेपी. सो हम एक पर्टिकुलर जगह का रेडिएशन करते हैं और उसका इफेक्ट भी उसी जगह आता है जहां पे हम उसे टारगेट करते हैं. हाउ डज इट एक्ट? कीमोथेरेपी के अलग अलग ड्रग्स के अलग अलग मैकेनिज्म्स ऑफ एक्शंस होते हैं. कुछ ड्रग्स कैंसर सेल्स को किल करती हैं, कुछ ड्रग्स कैंसर सेल्स की ग्रोथ को स्टॉप करती हैं, उन्हें किल नहीं करती हैं. लाइकवाइज रेडिएशन से जब हम ट्रीटमेंट करते हैं तो कुछ ट्यूमर्स में वो सेल्स किल हो जाते हैं एंड दे डिसअपियर फ्रॉम द बॉडी. लेकिन कुछ ट्यूमर्स जो स्लो ग्रोइंग होते हैं उनमें वो सेल्स डिसअपियर नहीं होते, दे जस्ट स्टॉप ग्रोइंग. रेडिएशन पर्टिकुलरली एक्ट्स ऑन द डीएनए ऑफ द सेल्स. जो जेनेटिक मटेरियल होता है सेल का डीएनए, so it causes damage of DNA, so the cell stops multiplying. That is how it stops the growth of that tumor.
Now, as I was talking to the other panelists, the treatment, cancer treatment in our country is pretty expensive. and the awareness is also very low. There's always a case that is taken that, COVID, there was so much of publicity of COVID, and awareness about COVID that was spread. Every TV channel was talking about, how should you address the problem of COVID. So maybe cancer needs that today, because we see cancer patients really increasing a lot, cancer increasing a lot in number. What do you have to say about this very expensive treatment and low awareness?
Very rightly said that cancer incidence is increasing. In fact, it is the second most common cause of death. अगर हम causes देखें कि किसी mortality के क्या causes हो सकते हैं, so cancer is second most common. Definitely it would vary from one disease to another. इसका incidence increase हो रहा है, इसके काफी सारे reasons हैं, अलग अलग diseases में अलग अलग risk factors हैं. एक बहुत important reason ये है कि हमारी lifestyle में बहुत major बदलाव है. जो पहले हमारा लाइफस्टाइल होता था उससे बहुत डिफरेंट है. वेस्टर्नाइजेशन है, अर्बनाइजेशन है, हमारी फूड हैबिट्स, हमारी एक्सरसाइज हैबिट्स सब बदल गई हैं. सेकंड मोस्ट इंपॉर्टेंट रीजन इज इमेजिंग मोडालिटीज बहुत अच्छी हैं, सो वी आर एबल टू पिक अप अर्ली डिजीज आल्सो. थर्डली, अवेयरनेस कम है, लेकिन फिर भी अवेयरनेस पहले के कंपैरिजन में ज्यादा है. सो एज कंपेयर टू व्हेन आई वाज डूइंग पीजी, or maybe my seniors were doing their post graduation, we see more people who are aware and more people who are detected in their early stages. So that is because they're coming up with symptoms at early stages. They don't keep waiting for problems to increase, and then we have technology to detect those early cases. So that also causes an increase in the early detection and increase in the incidence. Coming to the awareness part, so I'm sorry. किसी भी मीटिंग, किसी भी फोरम में जब हम ट्रीटमेंट की बात करते हैं, ट्रीटमेंट से पहले हमें प्रिवेंशन की बात करनी चाहिए. हम हमेशा अवेयरनेस की बात करते हैं. हमारी ओपीडी में भी इफ समबडी कम्स टू मी, मैं हमेशा उनसे बात करती हूँ कि अगर कोई फीमेल है, उन्होंने ब्रेस्ट की स्क्रीनिंग कराई या नहीं, उन्होंने सर्वाइकल कैंसर की वैक्सीन ली, अपने बच्चों को दी है या नहीं, सर्वाइकल कैंसर के लिए स्क्रीनिंग कराई है या नहीं. कुछ डिजीजेस ऐसे हैं जिनकी स्क्रीनिंग से हमें पता है देयर इज अ बेनिफिट इन मोर्टेलिटी. We can detect early and we can treat them early. So those are the diseases we have to be very, very aware of. One odd case जो unusual presentation है, उसके लिए हम screen नहीं कर सकते. That will not be cost effective at all, neither for us nor for US or UK. But for diseases which have a common pattern of symptoms, which are easily screenable, and we can pick them up early and treat them effectively, definitely वहां पे screening करनी चाहिए. और वहां हम हमेशा emphasize करते हैं, जितनी भी हमारी meetings होती हैं, we keep organizing sessions for patients, we keep making educational videos जिनको हम propagate करते रहते हैं. Not just we, the entire oncologist community, I would say, for that matter, चाहे वो medical, surgical, radiation हो, we keep doing a lot of awareness. एक challenge जो मुझे लगता है, that when we do such sessions, people are not very motivated to listen to them. They feel ये कैंसर की बात हो रही है, why should we listen to it? It is a negative thing. We should not know about it. So tell me one thing, कि अगर हमें ये नहीं पता होगा कि सड़क पे चलने से एक्सीडेंट कैसे हो सकता है, we will not be able to prevent it. So we need to know कि हमारी बॉडी में नॉर्मल क्या है और हमारी बॉडी में अबनॉर्मल क्या हो सकता है. Then only we'll be able to consult a doctor and pick early lesions. So एक जो स्टिग्मा है वो अभी भी है कि हम कैंसर जैसी चीज के बारे में बात क्यों करें, हम कैंसर की वीडियो क्यों देखें, हमें तो नहीं हुआ है, हमें ये देखने से नेगेटिविटी हो जाएगी. So that is one challenge. We do meetings, patients come and talk to us. When someone is diagnosed, then they are very anxious and they want to talk. But when we go to the community and we want to talk about it, we get very less audience because of that stigma. They feel ki why talk about it?
It's a taboo, still a taboo.
Yes. So it has decreased the taboo, I would say, to some extent, but still अभी भी लोगों में वो मेंटालिटी अभी भी है कि हमें इसके बारे में बात नहीं करनी चाहिए. टेल मी वन थिंग, हम डायबिटीज के बारे में बात नहीं करते. डायबिटीज इट नेवर गेट्स क्योर्ड. हम हाइपरटेंशन के बारे में बात नहीं करते, इट नेवर गेट्स क्योर्ड. एल्जाइमर्स और पार्किंसंस के बारे में बात नहीं करते, दोज पेशेंट्स आर नेवर कम बैक टू देयर नॉर्मल लाइफ मोस्ट ऑफ द टाइम्स. Patients who go into ICU, they suffer so much. Cancer is still treatable and completely curable if we detect it early. So why that taboo, why that stigma? We should talk about it more often to understand ki risk factors kya hai. We don't want to highlight ki suffering kya hai. See, diabetes के patients भी suffer करते हैं, hypertension जिनको होता है उनको भी complications होते हैं. We never say कि hypertension हो गया आपको stroke हो जाएगा, hypertension हो गया आपको heart attack हो जाएगा. We say hypertension ही तो हुआ है, एक tablet लो, अपनी diet ठीक रखो, अपना lifestyle ठीक रखो, you will be fine. Why can't we say that about cancer? You pick up early lesions, you be aware of your body, and you get treated well.
Also, I mean, there is a feeling also that the tests and the screening and the procedures are not easily accessible to people. Is that true?
So I wouldn't say they are not easily accessible. They are very much accessible, especially in private sector. Government sector में भी वो tests हैं, but yes, I would agree. For a country like ours, where the population is so much that our government sector is overloaded, and the resources in terms of manpower are not optimal in the super specialty segment. So there may be yes. Access का question हो सकता है, but definitely private sector में we cannot say that it is not accessible.
No, people don't know, when they come with some problem and they don't know कहाँ जाना है screening के लिए, कहाँ जाना है diagnosis के लिए, and many times there is a complaint also that hospitals also don't guide them really very well on it.
So as far as I am aware, like our hospital and many other hospitals, we are having screening programs. So if a person walks into our OPD, or for that matter front desk, and he requests कि मुझे screening करानी है, we have specific screening programs. We have a preventive checkup area also, where different kinds of packages are there which pertain to different age groups, male and female, depending on what test should be done for that person. So a person has to walk into the hospital. Once they walk in, I don't think that information is far away. I mean, social media, digital platform, Google, everywhere it's there. Before getting it done, yes, consulting a doctor is important so that you don't get the wrong test done and you don't get unnecessarily investigated. But then those tests, those packages are definitely there.
Okay, so a last word from you, Dr. Aditi. What will be your advice to for people seeking guidance?
So people seeking guidance, I would say that if you are having anything abnormal happening in your body, which is not responding the way it should as per your primary care physician, whether it is a gynecologist, an ENT physician, orthopedician, surgeon, जैसा वो response होना चाहिए, वो नहीं respond कर रहा है, वो problem persist कर रही है, get yourself thoroughly investigated. अगर कोई problem हो रही है, don't just make an excuse in your mind saying ये इसलिए हो रहा होगा, ये तो normal है, ये इस age के लिए normal है, इसलिए मैं नहीं जाऊंगा डॉक्टर के पास. I agree 90%, 95% chances hain, it will be nothing. But if we want to detect lesions early, then you need to go to the doctor saying that I have this complaint. Only then can we investigate and pick up early lesions.
Okay.
The second message that I would want to give here is, as Naresh ji ने बहुत अच्छी तरह से बताया, that medical insurance is very important. So that challenge we also face in our OPD. Treatment costs may vary from hospital to hospital, but in general, अगर for any person who's earning decently also, अगर आप उनको बोलो कि suddenly you have to spend this much, it is difficult for that person. So medical insurance helps you a lot there. And no matter how much we are earning, हम अगर सोचे हम इतना रखेंगे अपने पास for bad times, it does not happen. Medical insurance say you have that liberty of taking it, God forbid, if it is required.
Okay, you've really given a lot of insight to our viewers about the about the disease, and my Akshat and Naresh ji also, their experiences I'm sure will benefit our viewers. Thank you to all my guests and my viewers, and to my viewers, if you like our effort and appreciate what we are doing, do like, subscribe, share, and comment on the video. Thank you once again. Till the next episode, I'm signing off. Thank you once again.